Yes. No, because like after I gave blood, I was just so tired. Like, I didn't even feel like crying. It was too much work.
Okay, let's look at informed consent. What does informed consent sound like it should mean?
You're allowing them to do it.
Okay. Consent means you're allowing someone to do something.
They have to tell you. You have to be informed.
Yeah, you need to be informed, right? It makes sense. Informed consent. So, it says it's a signed document stating that the patient understands the medical procedure and the risks involved. So if I go in and I'm going to have a heart cath or something, I don't know. Okay, I'm going to sign a paper that says I understand what they're going to do, what the risks are, and so forth. Any kind of procedure, especially an invasive procedure, that's something that they're going to do. They're going to have you sign. It says all consents require a witness that is 21 years of age or older. It should always be signed in ink, no pencil or pink pen. Okay. It says consents can be given over the telephone in certain situations. These consents require two people to listen at the same time. So, and this came into play like when I worked at Children's, for example, and we would have a kid. I remember one time we had a kid who came from a camp. He'd been at a camp wherever, somewhere in the Dallas area, and his parents were like, lived a couple hours away. Well, he had, if I remember correctly, he had peritonsillar abscesses on each side. Peri means around, so he had basically abscesses on each tonsil, which are full of pus. Just like a normal abscess.
Like strep.
It could have been a strep bacteria, but it could be any kind of. These are actually, they have to take a needle and drain them. It's not like they just take antibiotics. These are like, they have to go in, drain it. So.
No, I want to get mine out because mine is still strong from when I had strep.
Yeah, that was definitely one of my most nerve-wracking procedures that I remember, because I remember it so well. We did lots of sedations, but that one made me the most nervous. And for good reason. They should have taken him into surgery. That shouldn't have been a conscious sedation done in the ER. He did fine, but they didn't get to do it. And he actually laryngospasm, which is like where your larynx spasms and closes up. And so if it does that, you can't get any air. And it just did that because of all the trauma, I guess, with what was going on. Anyways, it scared me. I'm glad I just wanted somebody extra in there because I don't know, I just had a feeling, Of course, the doctor's not going to listen to me having a feeling, about something bad going to happen. But anyways, and so I went ahead and called and had a respiratory therapist watch the sedation because I was worried about the kid's airway. And sure enough, that's what happened. And I was so glad I had the respiratory therapist in there. So, anyway. But point of that story is that his parents weren't there, so they had to have two people listen to consent over the phone, because they weren't there. Okay, it says informed consent implies that the patient understands the proposed methods of treatment. So basically what they're going to do. The patient has to understand exactly what's going to happen. Not exactly every little stitch and every little thing, but an idea of what they're going to do. What necessitates the treatment. So why they need this particular treatment. Okay, so I go in, like my dad went in for the pituitary tumor. Okay, they told him how they were going to do it. They were going to go through his nose to get that pituitary tumor, and if something happened and they couldn't go that way, they would figure out they'd have something else that they were going to do. So he knew that ahead of time. Let's see, what necessitates, he needed it because that pituitary tumor was putting pressure on his optic nerve, which was making him not see correctly. So he had to have it because he was going to damage his vision if he didn't. The potential risks. So one of the major risks for that surgery, for example, was a stroke, because anytime they do any kind of operation in the brain or near the brain, they have a risk for a stroke for sure, just because there's going to be bleeding. And so, yeah. alternative methods. So is there any other way? Is there another way to get this pituitary tumor out? You know, and I don't know how else they would do that actually, but
It's not safely.
so yeah, is there any other alternative method? They have to tell you that. They can't just say, okay, I'm pretty sure we need to do an amputation of your leg, and then, you know, they come back and they say, well, we could try this other procedure. Well, obviously, you're going to try whatever you have to before, you know, go to an amputation. So they have to tell you those things. And then the last one it has to have is the projected outcome. So what they expect. So like for my dad, they told him he would have sinus problems for the next year. That he would have, I mean, his sinuses, I guess they're so full of blood, they just bled, like his nose bled for months. And he wasn't allowed to sneeze. I mean, he had to like, I don't know how you don't
Hold it
sneeze,
in.
but yeah. Well, it wasn't like hold it in, because the pressure, the way that they do that surgery is they go through the nose and then they have to patch. Think they like deviate your septum, and they have, anyways, they had to patch up that area of the skull that was between, you know, I guess right in front of the pituitary gland. So that patch is what they were worried about. So he couldn't blow his nose, he couldn't sneeze. Did y'all know you can avoid sneezing if you look up at light? It works for me anyway. Somebody told me that one time, but it always works for me. I think it's more of like where you put your eyes, not looking up like this, but I think it's like, I don't know. Nice. Wisdom for the day. So, anyway, so those were all symptoms that he had. They knew he'd have a severe headache because he probably lost some cerebrospinal fluid, and we've talked about this a little bit before, but remember you have, you know, you got your brain, and you've got the fluid that surrounds your brain, and then you've got your blood vessels in your brain. And so if any one of those are off kilter, massive headache. Okay, that's just, so if somebody's losing cerebrospinal fluid, it's going to cause them to have headache. Somebody's blood vessels are really dilated on their,
How
in
you
their
get
brain,
more fluid if you-
headache. Do what?
How you get more fluid?
Your body creates it. There's certain cells that actually create that cerebrospinal fluid, or a certain part of your brain that actually creates it. But it just takes a little time, you know. Anyway, so those are all things that have to be included on that informed consent. All of these things. And then it has to be signed, and you have to have a witness. It says informed consent demonstrates that the patient was not coerced into treatment or test. So somebody signs that informed consent, you can't tell them they have to do something or make them. Remember, that's part of their autonomy. Remember that word now? It's their right to make their own decisions. You can't coerce them into it. Okay, it says individuals who cannot give informed consent include minors, with the exception of emancipated minors, married minors, or minors who live away from home and are self-supporting. So they're actually working, supporting themselves. People who are mentally disabled, senile, or insane. So they don't have the capacity to actually be able to make, you know, to sign an informed consent. They can't really understand what's going on. Somebody else would need to do that for them. Individuals under the influence of drugs or alcohol. So if somebody comes to the emergency room and they're under the influence of drugs or alcohol, they can't make their own decisions. Family member or next of kin is going to have to do that for them. People who speak a foreign language and may not fully comprehend English. Right? They have to understand. If you're not speaking in their language, then they can't sign an informed consent if they don't understand it. We have to have a translator.
That's what I was going to say. What happens if you have a translator? Because what happens if, you know, they wake up and try to sue the hospital if you do a surgery they didn't want?
Wait, say that last part again.
Because y'all did the surgery on them that they didn't even want. You know?
Right, no, you have to put in their language. And a lot of, like at Children's, we had a ton of translators, actual people translators, but we also had this call system where, like, I would get on the phone, I'd call in and say what I needed to say, and then there would be a translator on the other end, and then I would hand the phone to the person, they would say it, they would hand the phone back to me, go back and forth. That was more for people who we didn't have, I mean, we had a Spanish translator, and we had some of your everyday languages, you know, that you hear, but that, I remember using that with the Sudanese couple. You know, nobody at the hospital knew their language, you know, I don't know what their language is called, but anyway.
I don't even know what Sudanese people are.
Sudan? You never heard of Sudan?
Oh, okay. Never
Sudan.
mind.
What happens to like people who were like in a car wreck or something, and then you have to use surgery on them, right?
Well, remember,
If they're like unconscious.
yeah, if they're unconscious, they forego that right, you know.
Oh.
Now, obviously, if a family member's present, you're gonna get consent from the family member. If the family member's not present, they're gonna do what they have to do.
What if you can't what if you don't know who they are?
And they're still gonna do surgery, they're not just gonna let you die.
No, I know, but like, what do they do after the surgery? They just like.
I don't know, they look for identification, I don't know. I only know what I've seen on TV, I've never had that happen, so.
If they have
That's what they do on
memory,
CSI,
then
I
they ask
don't
them
know.
who they are.
She said CSI.
That's what they do on there. I
She's
don't
going
know.
CSI is not real.
It might be. It says patient education is vital to the issue of informed consent. Healthcare professionals should be sure that patients understand all forms and treatments before they sign. So it's the job of the healthcare worker to make sure that they understand, that they've had the opportunity to ask any questions, that they know these things, because, you know, even if they signed, if they didn't understand what was going on, they still have the upper hand in a lawsuit or something that's going on. So you have to make sure that they understand. It's put in words that they can understand. Now, if you've got an informed consent and it's written in all medical terminology, people aren't going to know and understand that. It needs to be written in terms, too. But that's informed consent. You do need to make sure that you know those things that have to be on there. The procedure, or the methods of treatment, why it's necessary, the potential risks, alternative options, and then whatever you expect to be the outcome. Okay, like somebody has an amputation of their arm, they need to realize that after the surgery, they're not going to have an arm. You know, it's going to die. You'd be surprised what people don't know.
They don't know that when you
I wish somebody had told me when I went and had my baby, I was still going to look like I was pregnant when I left the hospital. It was kind of disturbing because I still looked pregnant.
Were you freaking out?
That wasn't really an informed consent issue, but no, I wasn't freaking out. I knew I was going to be big, but I just didn't, I don't know, I just thought the belly was going to go down a lot more than it did.
Miss Hartwood, when she had her
My
baby,
sister's
she didn't look
did.
like she was pregnant afterwards. The day after I saw her, and she was flat.
Some people, yes, you know.
I guess that's because she did natural birth and not C-section.
I don't know, maybe that has something to do with it.
She
Okay, any questions over this?
Mhm.